We all have this relationship with the sun, right? We love it for its warmth, its light, maybe for that healthy looking glow. But for some people, that relationship is, well, it's complicated. It can even be dangerous. So today, we're going to dive into photosensitivity. What happens when sunlight itself triggers a totally abnormal reaction in your skin?
I think we've all been here. That painful lobster red skin after maybe a little too much time at the beach. That's a sunburn. It's what we'd call an expected and, yeah, a damaging response to too much ultraviolet radiation. This is kind of our baseline for what's normal when it comes to the sun. But what happens when your skin reacts in a way that isn't normal? That's what we're really getting into today, photosensitivity. And listen, this isn't just about getting a sunburn faster than your friends. We're talking about a truly abnormal response, where even small doses of sun, amounts that wouldn't bother most people at all, can set off a major reaction or a rash. So that begs the question, right? If what's happening isn't just a simple case of, oops, I stayed out too long, then what is it? What's the actual mechanism behind this kind of extreme sensitivity? Okay, let's get into the science of it. To really get a handle on these reactions, we first have to understand the different kinds of ultraviolet or UV radiation that the sun is sending our way. So, sunlight isn't just one thing. When we talk about UV radiation, it's actually split into three main types. First, there's UVC. But thankfully, our planet's ozone layer pretty much takes care of all of that for us. Then you've got UVB. That's the one we usually point the finger at for causing sunburns. And finally, there's UVA, which is by far the most plentiful type of UV that actually makes it down to the ground. Now let's just put the two that actually reach us, UVA and UVB, side by side. UVA is literally everywhere. It's the most abundant, and it can even get you through window glass. Now UVB? That's less than 10% of our total exposure. But don't let that number fool you. It is incredibly powerful. We're talking something like 1,000 times more potent when it comes to causing that red sunburn effect. So you've got one that's everywhere and kind of sneaky, and another that's less common, but wow, it packs a serious punch. So now that we've met the culprits, UVA and UVB, let's take a look at the case files. Let's look at the huge range of conditions that all fall under this big umbrella term of photosensitivity. And this is a really, really important point to get. Photosensitivity isn't just one diagnosis. It's a catch-all term for a whole bunch of different conditions. And the causes can be anything from your genes to a side effect from a drug or even your own immune system acting up. Let's look at a few examples just to see how different these can be. You can have something caused by your immune system, like polymorphic light eruption, or PLE. That often shows up as a really itchy rash that comes and goes with the seasons. Then, certain medications can cause what's called phototoxicity, which basically looks and feels like a sunburn that's been turned up to 11. And then you've got photoaggravation, where the sun doesn't cause the problem, but it makes a condition you already have, like rosacea, a whole lot worse. In this image, wow, it perfectly illustrates what one of the more severe forms can look like. This is chronic actinic dermatitis. See that sharp line where the skin was protected by the shadow from the earlobe? That kind of visual clue is exactly what doctors are trained to spot. Okay, so with all these different possibilities, from drug reactions to immune disorders, how on earth do doctors crack the case? How do they figure out what's really going on with a patient's skin? Well, it all kicks off with some good old-fashioned detective work. A doctor is going to listen really carefully to the patient's story and then meticulously examine that rash. The patient's history and the skin itself, they hold the first and most important clues. They're on the hunt for specific patterns. Where exactly is the rash? Is it on sun-exposed spots, like the face, neck, and hands? Is there a seasonal thing going on? And this is a big one. What areas are spared? Often, the spots that are naturally in the shade, like right under your chin or behind your ears, are totally fine. That sparing is a massive clue for a diagnosis. So once a doctor figures it out, what's the game plan? Let's talk about the strategy for managing these pretty complex conditions. The absolute number one, the cornerstone of managing this, is avoidance. I know it sounds simple, but it is the most critical step. This means staying out of direct sun, especially in the middle of the day, and making wide-brimmed hats and protective clothing your new best friends. And of course, sunscreen is vital. But not all sunscreens are created equal. You have chemical sunscreens, which work by absorbing UV radiation, and then you have physical sunscreens, think zinc oxide, that create an actual barrier to reflect the rays away.
For people with serious photosensitivity, those reflective physical sunscreens are often a necessity. Now, here's where things get really interesting, especially when we talk about SPF. We're all trained to look for that big SPF number on the bottle, but it's crucial to understand what it's actually measuring. SPF stands for Sunburn Protection Factor. It's specifically measuring how well it protects you from the reddening caused by UVB rays. So here's the big takeaway from that. If you have a condition that's triggered by UVA or even by visible light, a high SPF number doesn't tell you the whole story. It's not a guarantee of safety. You absolutely need broad spectrum protection. Just chasing a higher and higher SPF number could be a really misleading strategy. All right, get ready for a fascinating paradox. After we've talked all about avoiding the sun, what if I told you that sometimes the treatment actually involves more light, not less? It's a treatment called phototherapy. In a very controlled medical setting, doctors can expose patients to small, gradually increasing doses of UV light. For certain conditions, like that polymorphic light eruption we mentioned, this can actually induce a hardening effect. You're essentially building up the skin's tolerance before the summer sun really hits. It's like fighting fire with fire, but in a very, very careful way. So, after all that, what's the big picture here? I think it's that our skin's relationship with the sun is so much more complicated than just trying to get a tan or avoid a burn. It's this incredibly complex dance between radiation, our immune systems, and our own unique genetics.
And maybe the most important thing to remember is this. If your skin reacts to the sun in a way that just seems off or extreme, don't just brush it off as having sensitive skin. It could be a real medical clue, a signpost that's pointing to something more complex happening just under the surface. And that's a clue that's always worth investigating.